So here now is Dr. Taslim Ninji. You're an ER doctor from Humber River Hospital, fresh off your shift, so thank you for coming in.
My pleasure.
We look at Italy. It's a wealthy country, a top-tier medical system, and yet it's overwhelmed. So what does your ER look like now?
So certainly we are seeing increased volumes. We're seeing a lot more pressure on the emergency department system, especially as people are coming in even just for screening if they've had travel history or contact. And so we're starting to look at creative ways we can offset some of that volume in our emerge and in our hospital so that we can get to our sickest patients. So that's going to look like things like screening centers that are off-site, not in the hospital. And you're going to see, I think, an increasing number of those across the city and across the provinces. And then we're also really talking about how do we get creative about creating capacity in a system that is already close to full capacity. So we have surge mechanisms, as we call them, to get to that overage. We see those in influenza times, and now we're looking at that. So how do we get creative about creating space and capacity within our system to see these patients and treat them?
So that means maybe putting off elective surgeries, for example?
Yeah, that's a great question. So you know what, when we are talking about that, when we need to create space, we will do things like canceling elective procedures, elective surgeries. We can use virtual care mechanisms, off-site screening, things like that.
So what does Canada's medical system, do you think, actually need to stock up on at the moment?
Yeah, so when patients are coming into the hospital requiring hospitalization because of COVID-19, we're seeing a real spectrum in terms of what they need, right from something just like supplemental oxygenation, right up through an ICU bed and ventilation. So we're really having conversations at the hospital level to look at what capacity we have for ICU beds and for ventilators as an example. And then what we really need to do is look at sharing, right? And so we do normally transport patients from hospital to hospital if we need to, because one hospital is at capacity when another isn't. How do we do that safely? And how do we do that when there's pressure on all of us as cases may continue to increase in number?
Oh, the logistics are intense. Dr. Nimji, thanks very much.
My pleasure.